So I am representing here today European Federation of Allergy and Airways Diseases Patient Associations, and we represent people with allergy, asthma and COPD at the European level. And we have 4 key strategic objectives, and those are at the same time, as we see it, the key issues and areas for patients when we take Europe as a whole. The first one is related to prevention. We want all people with allergy, asthma and COPD in Europe to have a safe environment, and we put into that category, we put air pollution, tobacco control, chemicals, but also food allergen labeling, even if it's not a strictly environment issue. Then perhaps the most important one is access to quality care, despite where you live in Europe. And then the third one is patient involvement, so that all patients in Europe, individuals, they can be involved in a meaningful way in their own care. And there has been a lot talk about that in this forum as well. And the fourth one is inequalities. Patients are not equal in Europe in terms of how they can access care, what kind of environment they have, and how they can be involved in their care. So what do we aim to achieve with those 4 strategic goals? We want a Europe where all people with allergy, asthma and COPD have the right to best quality of care and safe environment, that they can live uncompromised lives and are actively involved in all decisions influencing their health. So there is a lot to do. How do we do that? Basically, one can group our activities in 3. We do projects from our own perspective, and we also participate in high-end research projects like MEDAL and EUBioBred and so on. And the purpose of this is, for us, is evidence and action for advocacy, because we are advocates. We are based here in Brussels, and we want to change healthcare policy, environment policy, research policy. But recently, we have also studied a capacity building program, and in that program, we are providing opportunities for our member associations in the different countries for a tailored capacity building program, whether it's about becoming a more professional organization, actually growing into an organization where you can have staff and so on, because also the patient community and patient organizations, we are not equal how we can work on these issues in the different countries. So EUFOREA was founded in 1996. Currently we have 42 member associations in 25 countries. So we are still, we totally need more. And in our member associations there are more than 500,000 patients and carers as members. We have a small but busy board. And currently Sweden, Netherlands, Austria, Portugal and UK are represented in the board. And we are, as I said, we are based here in Brussels. We have a small and busy team there. This is EFA from our AGM this year in London. And okay, let's go to the core issues now. So what are the patient goals? Here are some of them. Patients want to be cured. They want to be saved if they have a very severe disease, for example, a very severe allergy. They want to be able to do X, Y, Z, whatever it is that they want to be able to do in their daily life, or they want to be able to continue to do whatever they prioritize in their life. They want to be able to grow up, they want to be able to grow old, they want to be able to live as close to normal life as possible. I want to give you 3 examples on the kind of EFA European level initiatives that we have at the moment, just to give you a taste what the patient community is doing in order to improve the situation. The first is about patient involvement in research. We are involved, I said that we have been involved in MEDAL and so on, but for us it has been also a very long road to learn as a patient organization to be meaningfully involved in a high-end European level research project. My air coach was one of the first. It was a project from the first call of Horizon 2020, and it aims to develop mHealth personalized asthma monitoring services. And in this project we were able to be from the very beginning. We were able to develop our role in a way that we have never done before. So EFA is leading the work package on dissemination in the project, and we are also leading a work package on patient involvement, where we have a so-called My Air Coach European Consultative Patient Forum composed of 23 patients and carers from across Europe, whom we as EFA Secretariat, we help them to be involved in every stage of the project together with the researchers. And this kind of approach, we are learning through the project how it's working, and it's working better and better, but there have been difficulties in getting all of the researchers to accept that patients need to be listened. They are keen to do it, but in practice, how will they integrate it into what they are developing? So what the Advisory Patient Forum is doing, it's providing continuous feedback from patient experts to other members of the consortium, and it's helping to include the patient perspective across all project work packages. And it's ensuring that the mHealth tool that is going to be developed is actually something that the patient will then use not only 1 week, 2 weeks, couple of months, but on a continuous basis. For example, their feedback has told that they don't want to be monitored. They want to have feedback, but they don't want to have the feeling that they are monitored. Although to that, I have to say that all the patients in this forum, they are middle-aged or older. So I'm not sure. Young people may not mind that they are monitored. I don't know. I'm not young. Another example of, so with that, we want to move further in the patient involvement in research so that we can really be useful partners together in a research project. Then my second example is a project that we recently finished. We published a report on asthma and adherence, health literacy young patients with asthma and adherence to treatment that we call HEIA. This was done directly asking from young people 12 to 17 years old, not their parents, about their adherence and health literacy. This is initiated by EFA, and it was done by our commission, by GfK, which is a big market research agency from Germany. Our scientific advisors were from Professor Helmut Brand from the Maastricht University, who is doing a lot of research on health literacy. So it has been presented in many places, at the IACI, ERS, published at the European Parliament. But what we wanted to do is to see what's really going on there in adherence. And I don't want to talk about compliance because I don't think it works. So this graph is summarizing the results of the survey in terms of adherence. So the score that you see in the graph is kind of a measure of overall adherence, and where you could get a minimum score of 4 or a maximum score of 20. And that is a result of answers to 4 sub-questions, and they are summarized in this score. The 4 questions where I follow my asthma treatment as I'm told by my doctor. The second one is, it's difficult for me to take my asthma medication as my doctor told me. Taking my medication enables me to be active, or my busy life hinders me from taking my medication. But you can see that there are some very interesting differences between the countries, even if we only have 4 countries, because we couldn't get funding for more. So Germans are very good, whereas French and UK, they are a little bit more inclusive and want to make their own decisions. And there is a lot to say about this survey. But what was very good news for us is that unlike we often think that people don't want to talk about, for example, their asthma, young people actually, they said they don't mind. They think that their friends understand their asthma problems, and they don't mind telling about their asthma to others. What is interesting, that there are things that are the opposite, showing to the opposite directions. And okay, we are talking about young people, but it is very, very interesting. The young people say that I think that I know what happens if I don't take my medication, and that they know how to take their medication, but I stop taking my medicine when I feel better. So what shall we do? The next one is really for you, because the young people, the good news is that they trust their doctors, but I don't do what my doctor tells me about my asthma. So there you go. This has been discussed very many times during this meeting. So there was 6 key impactful factors in this survey: forgetfulness, rebellion, not surprisingly, we are talking about young people, good days, the kind of support that the young people receive for their asthma care, carelessness, and ignorance. This picture is for the health literacy, a so-called, I don't know what it means, but so-called driver analysis was done in order to understand what are the issues. Is adherence linked to health literacy? And from this survey, attitude was linked to health literacy as a driver. And I think that is very interesting for all of us. Then there are some recommendations arising from this, not surprisingly. Multidisciplinary, this is what we need. Health, ICT, technology, especially considering the target group, but it has to be developed with them. Empowering young patients through shared decision-making and tailored health literacy materials, but we also need some additional research to understand what is the impact of the adherence as we see it now. Then this is our major campaign at the moment, and we need you to act, to believe and care together with us. The ABC to take action on chronic respiratory diseases. The previous speaker said that we don't have the kind of priority for respiratory diseases and allergies that we need, and many other disease areas are leading. And this is what we want to achieve with this campaign. And the campaign is in full partnership and equal partnership with the IFA, ERS, IACI, IPCRG, European Patients Forum, European Lung Foundation, Pulmonary Hypertension Europe, European Network for Smoking Prevention, and Health and Environment Alliance, and Cystic Fibrosis Europe. But we need you as well. This is our campaign leaflet, and what we want to achieve is a written declaration from the European Parliament on chronic respiratory diseases. And why should we ask something like that? Written declaration is a non-binding document, but we don't have anything similar. We have the Polish presidency paper, but this is a step, this is the next step, and we need it. And if we get it, it will be a reference paper for all of us, so that we can ask for more research funding, combating the risk factors for our disease areas, the respiratory education, lung health tests, reimbursement, and in this plea we are referring to the international guidelines. They have been discussed many times during this, but guess what? In Europe, we are not equal in the kind of care we receive, and this is the reference for access to certain types of treatments. Rehabilitation and a multidisciplinary approach. What we need is half plus one of members of the European Parliament to sign this document, and that means 376. You might think it's very easy, but it is not. These people receive 1,000 emails a day. But let's say that if each one of you get one of your MEPs to sign this, then we are already very far. The problem is that we have 3 months. The lapse date for this document is 24th of January, so it's speed, quickly. We need to do it, and it's going on. And this is the BREATHE mission, and it's our health, and it's their mission, the members of the European Parliament. So we have with the ERS and ELF next week event at the European Parliament in Strasbourg, where we're having a spirometry testing and trying to get signatures for this written declaration. You see there on the slide what's the number of the written declaration. If you would like to get involved, we can send you the materials. We have them in 20 languages, and we have done everything in order to get this passed now. So we have a mission: prevention, diagnosis, care, rehabilitation. Finally, so the topic of my talk was a vision for a better approach, and I think that it is to support self-management in whichever way we can. And from our perspective, it starts with the diagnosis. Should be early, should be correct. Care that is individual, multidisciplinary, personalized, but also affordable. And then care as such is not enough. It has to be coupled with the patient education and follow-up, and only with that we can achieve adherence and empowerment. And for us, e-health, m-health, and telehealth are major opportunities and tools to achieve this. And we would like to arrive to a cure one day. Scientific community never talks about cure because you know how many steps it takes to arrive to that, and there is still a way to go. But please keep in mind, patients want cure at some point. So that was my presentation. I hope it gave you some idea what we are doing and what we are trying to achieve. And I thank you very much.